Navigating the early days of parenthood can be overwhelming, but don't worry, I've got you covered. In this video, I'm sharing 5 newborn tips that every first-time parent should know to feel more confident and prepared. And the very first one should not come as a surprise, but it is skin-to-skin contact. People underestimate the power of skin-to-skin contact when a baby is born. There's a reason that they call it the 4th trimester. And to get used to the outside world and to adapt to the changing environment, that takes time. And the only thing that they know is your heartbeat, the sound of your voice, a feeling of warmth around them, and not being alone. Now, we put them down, we walk away, it's silent, there's no heartbeat, they're all alone. It can be disturbing for many babies, and skin to skin is the closest thing that resembles the uterine environment when you are pregnant. You cannot do too much skin to skin. That means without any clothing, just a nappy. This is a really big doll, but the baby is lying skin to skin on your chest. You don't have anything on, but you can both be covered by a blanket. Just like this, so that the baby has something covering, but you've got the benefit of skin to skin contact. When you hold them close, it promotes breathing, it promotes temperature regulation and bonding. Just make sure at all times that the baby's head is turned out. It is not recommended to fall asleep with the baby on your chest because there's a risk that the baby might roll off or the baby might turn their head back into your chest and you don't realize that they're in a compromised position. So this is your number 1 solution for most problems that you will encounter in the first couple of weeks. Number 2, do yourself a favor and learn the hunger cues of babies so that you can recognize them. Things like sucking on their hands, the rooting reflex, baby stretching, those are all part of hunger cues that a baby gives you before they start crying, which is the one sign that people often look out for, crying. That is usually the last of the hunger cues that a baby will give you. Every baby's hunger cues is a little bit different and unique to them, so you will learn over time what to look out for. Tip number 3, safe sleep practices. It's often referred to as the ABC of safe sleep, which is alone, on their back, in a crib. And if we say crib, it is a flat surface with nothing around them, just the baby alone on their back in a crib. Things like loose bedding, fluffy toys, these cute cot bumpers that you get these days, they all increase the risk of SIDS, which is up till today not 100% understood why it happens, but we know there are certain factors that increases the risk, and loose things around the cot can compromise a baby's breathing, which is why it's a higher risk for SIDS. Tip number 4, burping is essential. It takes time. It can sometimes be 20 minutes. Babies can cry a lot during this time. You might struggle to get the winds out, but if you don't burp, there's always some air that is trapped and it causes a lot of discomfort for babies and it makes them cry, and you might not understand why, and a simple solution might just be that they were not burped enough. So after every feed, if you are breastfeeding and you switch between the breast, burp before you offer the second breast. Just help babies to release the air bubbles that get trapped when they swallow. This is for the first couple of months. Babies have different times when they stop needing to be burped. That is often between 4 and 6 months where you don't need to burp your baby anymore. And tip number 5, the biggest question mark to figure out why your baby is crying. Well, to just look at your baby and think, oh, maybe this is a reason, that's not going to get you very far. You might never know exactly what is bothering them, but I'm going to give you a checklist to help you eliminate potential causes of crying and what you can do to address it. The very first one, is the baby wet or dirty? Very simple thing that you can do. You don't need to open the nappy completely. You can simply check in the side of the nappy. Number 1, if it's a dirty nappy, you will see the brown sitting all around here. You don't even need to touch it. You can also pull it away to see if you can see anything inside the nappy. You can see if I hold it there, we should technically, this nappy is a little bit small for this doll, but you will be able to see inside the nappy. If you have nappies that's got a line, it will change color if the baby is wet. You will also be able to see if it's a wet nappy by the look and feel of a nappy. When a nappy gets filled with urine, it gets heavy and it starts looking fuller as well. You can also do another finger check by the back if you pull this back and see if you can see anything. But there is a risk with this. Use one finger and be careful if you check here and if you check here, because sometimes you don't see anything, and the moment you stick your finger in, you stick it right into the poop. I'm pretty sure it happens to every parent out there, and we are grossed out a little bit and we get over it. That is one way to see, is your baby wet or dirty? If it is, change the nappy and see if your baby wants to settle. The second reason for crying is your baby cold. So in the winter months, a cold nose, cold hands, that's quite normal for babies because their blood flow is directed to their internal organs and not always to the hands in the winter time. So just a cold nose or hand doesn't mean that your baby is cold. One way that you can check is on the chest of the baby. So if you put your hand inside to the chest of the baby, it shouldn't feel cold. A baby's lips will also give them away. If the lips are blue or purplish, or even the baby, it means they are cold. However, if your entire baby looks bluish, that is a much bigger concern than just being cold, and I suggest you get your baby to the doctor because that's not normal. A little bit of a blue tint to the lips with a baby that is otherwise looking pink, that is still okay. And then another thing that you can look for is if a baby wakes up frequently. If they are cold, they will wake up frequently. If they are left for very long and they are cold, they can become the opposite, where they are difficult to wake. But then you will be able to see that they also blue around the mouth. Your baby should not get to the point where they are this cold unless you're living in places with extreme weather conditions, in which case you're going to take very careful precautions to make sure that your baby is warm. And the general rule of thumb is whatever you are wearing, the baby should have one extra layer. Now the opposite is also true if a baby is too hot. Now we know that babies can't sweat under their arms like we do, but they do lose heat through their head. And if a baby overheats, they can look flushed, especially their cheeks will be red, their skin can feel clammy and even a little bit wet. They might also be lethargic. If you think your baby is a bit too hot, try and remove a layer of clothing and make sure that they don't perhaps have a fever by checking their temperature. A very important tip here that I want to share with you: if you put your baby in a stroller or in a car seat with the cover over, in hot conditions, that cover should not stay on. It doesn't allow airflow. It's like a little heater that this baby sits in, and you might think that you are protecting your baby from the sun and all the people around, but there's no airflow. It's a hot day and this baby is baking in this little seat. This is one of the biggest causes of overheating in babies. What you can do is lift the bottom or the sides or open up to allow airflow for the baby, or rather take it off completely and just put the car seat down, that they're protected from the sun but that they're not overheating. Next one, cramps. Obviously this is a very obvious one that you might think of, but how do you know if it's cramps? So when babies have cramps, they usually seem very unsettled and irritable. They kick their legs or they pull up their legs to the chest because it's painful. They have a high-pitched scream that doesn't sound like a normal cry. It sounds like they are in pain, and they might be arching their back like this, trying to get away from this discomfort that they're experiencing in their tummies. They might also have clenching fists and not be able to settle and put to sleep. If they are having cramps, you can try to burp your baby again, because it might just be a wind that is stuck somewhere. If it persists and they have it with every feed, there are certain solutions available on the market, and it differs in every context, that you can try and give to your baby that will help with the cramps. If you're unsure what to give, rather reach out to a healthcare provider in your area and get a recommendation from them if you are struggling with this. You also need to make sure that it is not actually reflux that the baby is suffering from, which is the next reason why they might be crying. And reflux happens when the milk in the stomach pushes back up and it is sore. It's basically, in adult terms, we refer to it as heartburn. So it's really uncomfortable for babies and it can unsettle them. They can cry and it can cause a lot of distress. But whereas cramps can be an acute thing, which eventually settles and a baby goes back to sleep, reflux is over a long period. It is not diagnosed with a once-off episode. It comes over time, and it is with every feed that this baby is struggling. The typical signs of reflux is when a baby is spitting up a lot, they cry after every feed, and it usually worsens after a feed. They are unable to settle nicely after a feed, and they cry for long periods of time. They might experience a lot of coughing or hiccup during the feed and look like they are swallowing or gulping a lot after a feed. If they feed very poorly, weight gain might be affected in the long term. And silent reflux is similar, except they don't bring up all of that milk, so you don't always realize that they are suffering from this. So you can try a few things if you think it might be reflux. Number one is to feed them upright, because the moment they lie flat, it's easier for the contents of the stomach to push back up. So you can feed them upright and use pace feeding. And pace feeding is just a slow way of feeding a baby, where you give them a little bit of milk, then you take the bottle away, give that milk time to settle, burp them, get all the air bubbles out, feed them again. But basically you're not overloading their stomach with milk, which is just going to push back up. You're giving it time to be digested while you are feeding the baby and getting all the air bubbles out, to minimize any chance of the milk pushing back up and causing their discomfort. There are formulas and medications available that will thicken the milk when you give it to the baby, and that also helps to not let the milk push back up. But remember, you cannot pour from an empty cup, and if you neglect looking after yourself, not eating enough, not sleeping enough, that's easier said than done, I know. Not accepting any help when people offer to help, you are going to reach a point where you might burn out. So make sure that you make time somewhere during the day to do something for yourself, something like a cup of tea, just taking a shower, just washing your hair, just listening to your favorite song, something that reminds you of your old self that is still deep inside there, within all this chaos of bringing a newborn home. And don't hesitate to ask for help if you need it. While we're on this topic, I also have a video where I share the 5 most common mistakes that I see new parents make. Maybe this relates to you. You can check it out here.